Hello, my future and welcome back. This is Lombard here. Today we're going to talk about the concept of ECGs, electrocardiogram. If you are starting your med-surg courses in nursing school, you are going to need to learn how to read rhythms. Or maybe you're a new nurse starting in the tele unit or the ICU. Don't worry, I got you. I'm going to show you how to interpret ECGs in 5 easy steps, okay? And before we get to our content, press that like, subscribe, and notify button. Press every button on your computer because we are working on a lot more content to help you be the better nursing student, to help you be the better nurse you can be. So stay tuned. Okay, 5 steps to ECG interpretation. Let's review some of our learning objectives. We're going to look at the electrical anatomy of the heart. We're going to get a basic understanding of the components of the EKG complex. And we're going to review those 5 steps for interpreting your ECGs. And then we're going to apply those steps into some practice examples. So now let's take a look at the electrical anatomy of the heart. So the heart's electrical conduction system is made up of specialized cells that creates an electrical impulse. It actually creates an electrical chemical impulse that creates energy. So when you put those electrodes on the chest, it picks up that energy and then you get your ECG tracing. Okay, so now let's examine the first fuse box, you might want to call it. That's the SA node, or the sinoatrial node, and that's located in the right atrium. So this is the main pacemaker of your heart. It fires impulses between 60 and 100 beats per minute. When the SA node fires, that is considered a sinus beat because it's coming from the sinus node. The impulse is going to travel down the internodal tract in the atrium, and then it's going to go down into the AV node, which is the backup pacemaker. So as a backup, it's not going to be as strong, as efficient as the main pacemaker. It's just a backup generator, you might say. And that fires at a rate of 60 to about 40 beats per minute. So the AV node's main responsibility is actually to slow down the conduction of the impulse fired by the SA node. So it gives it time for the atrium to contract before it sends it to the ventricle. The AV node is responsible for delaying it just enough time for the atrium to fill up and empty. So now from the AV node, that impulse travels down the left and right bundle branches, which is located in the lower part of the heart, in the ventricular muscle of the heart. And then from the bundle branches, it goes down to all the way down to the Purkinje fibers. And as it goes down that pathway, the heart rate impulse is lower and lower. Okay, now, so let's look at the different components of a rhythm. But before we do that, we're going to take a look at that tracing paper that you read a rhythm on, and that's important. ECG tracings are read on EKG paper, which helps you measure your rhythm by using time and distance. And it's measured in millimeters and milliseconds. So knowing the measurement of the large and small boxes is very important. That's key into analyzing your tracing. So the small box is 0.04 seconds. Large boxes are made up of 5 small boxes. So a large box is 0.2 seconds. We're going to see how this is incorporated into our analysis a little bit later on. So basically, our components of a ECG complex includes your P wave. The P wave, normal P wave, is about 4 to 5 boxes long. That is what considered normal. So 4 to 5 boxes. So we know each small box is 0.04 seconds. So it's about 0.20, one full large box long. That's your P wave. The next component you should be familiar with. The PR interval represents the time period from the beginning of your P wave to beginning of your QRS. Now your QRS, it went past that AV node. The QRS represents your ventricular rhythm. So normal PR interval is between 0.12, 0.12 seconds to 0.2 seconds. I usually just say 12 to 20 is normal PR interval. Anything greater than 20, you have to rule out a heart block. So we covered our P wave, which is the first wave in our complex, which represents the sinus. We covers the PR interval, which is the distance from the beginning of the P to when our ventriculars start reacting. So now we come to our QRS complex, which represents our ventricular depolarization. So the next component of our ECG is the QRS complex. So now the QRS complex represents ventricular depolarization. It's composed of two waves, our Q wave and our SRS wave. Sometimes the Q wave can be a negative deflection, which means it's pointing down. And if you could see my pointer, this is the wave that's going downhill like a valley, or sometimes it could be absent. So with everything in EKG interpretation, you have to take into account the width and the length of the components. It tells you whether it's significant, if there's some kind of underlying pathology there, or if it's something you need to follow up. So we've reviewed our QRS, which represents our ventricular depolarization. Now we're going to go into the ST segment. This section in your ECG starts at the end of your QRS complex to the beginning of your T wave, which is your third kind of hill on your complex. This segment, your ST segment, is usually found along the baseline of the complex. It could vary between 3 millimeters above the baseline, but any significant elevation of this segment is considered significant. So that is something that needs to be followed up. Our next wave is your T wave, and that represents ventricular repolarization. So this is the next deflection after your QRS, and it's usually a positive deflection. If it is negative, which means it's pointing down, you need to follow up. It's indicating some kind of pathology in the heart conduction system. After our T wave, we have a QT interval. So that's the beginning of your QRS complex to the end of your T wave. Now this represents all your ventricular events, which mean depolarization and repolarization. The length of your QT interval can be affected by age, sex, electrolyte disturbances, and your heart rate. So ideally, your QT interval should be half the measurement of an R to R wave. So if we had a full complex, you measure 2 R waves, which is your 2 tall peaks. A normal QT interval should be less than half of that. Long QT intervals increases your risk of detrimental events. So knowing your measurements of your components of your ECG is very important. After your QT interval, there's some variations. Some people will have something known as a U wave. And it's a small, flat wave seen after the T wave, but before the P wave. It's a normal variation. It's especially seen in those who are bradycardic. But it could also be seen for those who have a low potassium hypokalemia, and that's your U wave. So again, we have our P wave, which is the first wave in our ECG complex, which represents our sinus node is firing. Then we have our PR interval, which should follow the baseline. And then we have our QRS complex, which is The tallest wave should be the tallest wave, which represents our ventricular depolarization. Then we have our ST segment, again, back to baseline. We have our T wave, which represents ventricular repolarization, and then sometimes a U wave, which is a normal variation depending on the patient's state. Okay, so steps to analyzing a rhythm. So write this down. Step 1, we're going to determine whether the rhythm is regular or irregular. So the step 1 is to determine regularity. Step 2, we're going to calculate the heart rate, and I'll show you a few ways of how to do that. Step 3, we want to identify and examine the P waves. The P waves is so important because we're looking for normal. We want it to be a sinus rhythm. Step 4, we're going to measure our PR interval. Remember, we want to rule out a block. So this step is important. And then lastly, step 5, we want to measure our QRS complex. Step 1, we're going to determine the regularity of the rhythm. You mark your 2 R waves, this quick little video, and you march it right across, okay? If they land on each R wave, it's regular, okay? You do this until your eyes is trained to see, okay, this is a regular rhythm. You would be able to see exactly when the next beat should be coming. So step 2 is to calculate the heart rate. There are a few methods of calculating the heart rate. The easiest method is the rapid calculation. So if you get a 6-second strip, which I'll show you later what compromises a 6-second strip, you're going to count your R waves, and then you're going to multiply it by 10. It gives you an approximate rate. The rapid calculation can be used for both regular and irregular. Now, the precise calculation is to count the number of small squares in between 2 consecutive R waves. Put your glasses on, get your magnifying glasses. You count the small squares between 2 consecutive R waves. Then you take that number and divide it into 1,500, okay? But this could only be used for regular rhythm. So this is a little bit more precise. For example, if you counted 13 small boxes in between 2 R waves and you divide 1,500 by 13, you would get a heart rate of 115 beats per minute. 1,500 is the magic number. You count your little small squares in between 2 consecutive R waves, and then you're going to get your rate per minute. Step number 3, identify and examine the P waves. 1 P wave for each QRS complex, 1 P to each QRS complex. And all the P waves should be identical or near identical in size and in shape. The bottom picture, the bottom rhythm, these are normal identical P waves, okay? Each QRS complex have 1 P wave. So all the P waves should be near identical. It should only be 1 P wave before each QRS. If it's not coming from that sinus node. It's not coming from that pacemaker. Okay, step number 4. You want to measure your PR interval. We want to make sure this is not a hard block in any way. We want to make sure that that AV node is not holding on to that impulse any longer than it has to. Normal PR interval, as we mentioned, 12 and 20. That is normal. So our PR interval should not be longer than 5 small boxes. Both PR intervals in this picture is with the normal limits, but it's just showing you exactly where you would measure. If you have a deflecting negative deflection of a Q wave, you want to measure it right before that Q wave. Okay, now our last step to our ECG interpretation is to measure your QRS complex. So you want to measure the beginning of your QRS, the width of that QRS, and it should be no more than 2.5 boxes. So we're going to have normal QRS is between 0.08 to 0.10, between 8 and 10. So now it's time to practice. We're going to take the steps that we just learned, and we're going to apply it to analyzing ECG. The first step for our ECG interpretation or analysis is to determine regularity. So although you can look at this strip and say, yeah, it's kind of regular, let's go through the steps just so we could solidify the process in our minds. If you have a caliper, you could walk the caliper through, or if you have an index card, DIY a caliper, do an index card or paper, mark your first 2 R waves, and then march it down. I want you to notice these little red red arrows are pointing to these notches above. 3 notches would indicate a 6-second strip. So we have 3 seconds from the first to the second notch, and then second to third is another 3 seconds. So this is a 6-second strip. This is important because any complex that falls outside of that notch, those should not be counted in that rate. So let's determine, we already determined that this rhythm is regular. Let's calculate the heart rate, and we're going to use the rapid calculation. So we counted 1, 2, 3, 4, 5, 6, and we're not going to count this last one because it falls outside of that notch. So if we multiply that number by 10, we have a rate of 60 beats per minute. Okay, so far it's looking like a sinus rhythm, but how do we know it's sinus? We want to look at the P waves. So we're going to examine the P waves. There's 1 P wave in front of each QRS complex. All the P waves seem to be identical. They all are facing in the same direction. So let's say, yes, these are normal P waves. So now let's determine the PR interval. We want to measure that length. We want to a range between 12 and 20. So we measure those small boxes. We have about 4 to 5 boxes. So that's about 0.20, and that falls within the range. Okay, so our PR interval is normal. So now let's look at our QRS complex. QRS complex is half a box, is about 1 box, which is 0.4. So that's normal. So our answer for this rhythm strip is normal sinus rhythm. We want to know what normal looks like. Okay, so here's our next rhythm. Where do I start? Where do I start? Okay, so if you get to a place and you see a rhythm and you have no clue, this looks like your child scribbled on a piece of paper, just go back to your steps. First, let's determine, is it regular? Because you want to rule in a sinus rhythm. If it's not sinus, we know we need to follow up. We know we need to call a doctor or get a 12 lead. But let's go by our steps. So step 1, is it regular? Yeah, it looks pretty regular. That same arrow is hitting measuring between each R's. And these are R's, that tall peak, these are R waves, QRS waves, okay? Step 2, let's calculate the heart rate. We're gonna start counting our R waves right in between those 2 notches. And we have about 18 R waves. And if we multiply that by 10, that's 180 beats per minute. Okay, so we know this is no longer sinus, okay? But let's be sure. Do you see any P waves? Nope, you don't see a baseline. You don't see a nice little, nice small wave. So there's no P wave. So it's not coming from the sinus node or the atrial node. PR interval, since we have no P waves, we cannot measure PR interval. So now the next step, the last step, QRS. Is a QRS between 0.08 and 0.10, between 8 and 10? I counted about 5 boxes in this QRS, so which is about 0.20, which is 20. So this is a wide QRS complex, okay? So we know it's not from the sinus or the atrial. This is all ventricular. And the fact that the rate is fast, this is called a ventricular tachycardia. Okay, this is our answer. So this was just, and that is it. Not it for our playlist. Click on the next video so you get more practice in analyzing EKGs. And please like and subscribe, press that notification bell, and I hope to see you again.